My name is Ashley Thompson, and I am Fruit Tree Extension for Oregon State University in the Mid-Columbia region. And today we're here to talk about Orchard COVID-19 preparedness. And I'm really happy that we're here with our partners from North Central Public Health, Hood River Public Health, as well as One Community Health, MCMC, and some folks from Unified Command. So let's go through our introductory to Zoom rules. So many of you were wondering if you're muted. Well, I have you all muted, right? So we know how that can be sometimes when people aren't muting themselves, we get a lot of feedback. So I have you all muted. If you need something, you can raise your hand and myself or one of the panelists will try to help you. And I say raise your hand if you're having some sort of like technical difficulty. So we do have a Q&A box, and this is going to be the most important box. If you have a question that comes up during this webinar, please use the Q&A box. This is going to be how the panelists can respond to you, but also what I'm going to do is I'm going to collect those questions from all of you at the end of this, and we're going to get written responses to them, and I'm going to post them on our OSU website, and I'm also going to make them available to the growers via our mailing list. So this is the most important box you can use when a question comes up. Do not use the chat box for questions. It could be a good way to get our attention for technical difficulties, but do not use it for questions during this webinar. We will likely miss your question if it is not put into the Q&A box. And all of these are in this little black toolbar that you guys should have at the bottom of your screen if you are just viewing this webinar. So I'm gonna stop sharing my screen now. And I am going to let Dr. McDonald from North Central Public Health share her screen. Mimi, there should be a green box at the bottom for you that should say share screen.
I did do that. Did that work?
So it's not here yet.
I may have to do my, let's see if I can go back to screen one. Sorry, everyone. We're going to get there in a second. Promise. Well, I may have to do the not as fancy slideshow, but we'll do that. Okay. How's that?
I can see your screen, Mimi.
Well, I hope that everyone else can as well. So good morning. I'm Dr. Mimi McDonald, North Central Public Health District, and I've had the great opportunity to work with Ashley Thompson and so many other people in working on putting some of this information together for you all. I want to make sure that people understand I am not a tree doctor. Unfortunately, I'm a person doctor and a population health doctor, so I will not be able to help you with your tree problems. However, what I'm here to do today is to really provide some information about the guidance that Oregon Health Authority and OSHA have put out, how to keep your seasonal workers safe, how for you guys all to be safe, your your full-time workers, your seasonal workers, everyone's safe, and for you all to have a successful growing season as much as possible. So I will also add, just as a small caveat, that although I'm here to help interpret the rules and I can absolutely bring back any feedback about the rules, I did not generate them, so please just don't shoot the messenger, I think is what I'm trying to say. All right, so thank you again, and I'm just gonna get started. So what I want to talk about today, I'm going to give a brief COVID update, how things are in our region, in our area. I am going to talk just a little bit of science. You guys are horticulturalists, so I'm sure that you can stay with me on this because I think it's important to understand the virus and how it spreads. That way we can keep people safe and talk about just basic general strategies for keeping people safe and then going over the OHA or OSHA specific guidance for you all. I do have a tendency to talk very fast, so you may have to virtually shout out to slow me down. So I'm going to talk a little bit about where we're at in our region. These numbers are also available on the OHA website. There are other updates, both Hood River Health Department and North Central Public Health District. We have websites that are dedicated to this, but currently in Hood River, there have been 11 diagnosed cases of COVID-19. In Wasco County, 14 cases. Sherman County, 1 case. I also cover Gillum County, 0 cases there. In Oregon, as of this morning, are 2,916 cases. And just for an estimate, that's about almost 10 times fewer than what they have in Washington State, even though we only have half the population. So I have to say, in the state of Oregon, I don't want pride to go before a fall, but we've been doing an excellent job. People have been doing a tremendous job of staying home and staying safe. So that's exciting news. In the United States, we are up to about almost 1.2 million cases. Worldwide, there are about 3.5 million cases. So what is it? This goes by many names. So some of what generally we refer to it, COVID-19 is probably the easiest way to think about it. You'll also see the 2019 novel coronavirus, or SARS-CoV-2. What symptoms does it give people? I think you've probably heard of a lot of these. Fever, cough, shortness of breath are the ones that we heard most often of, but then some new ones got added. Shaking, chills, muscle aches, sore throat, headaches, and also what seems to be an odd symptom, but definitely is reported, is people will experience a loss of sense of taste and sense of smell. I'm sure you're also aware of this, that people can have this infection and not have any symptoms. We call those asymptomatic people, but unfortunately they can still transmit this infection. Other people just have a mild illness, but of course you know that some people have very severe illnesses and unfortunately very rarely can even cause death, excuse me. You also probably heard that there are some high-risk groups. Now, the older I get, the more I object to older being 65 and up, but that's the definition that they've mostly been using. So people who are at a higher risk of experiencing severe complications from this disease are people who are 65 and up. Those who already have heart and lung problems like cardiovascular disease, high blood pressure, lung problems like really severe, well, asthma or chronic lung disease. People who are immunosuppressed, maybe they're taking a medication that lowers their immune system. Other things, or it seems like people with diabetes are also at higher risk for complication. I'm going to talk a little bit about how it's spread. And for those of us who are old enough to remember a time when it wasn't uncommon for people to get measles, the way that we think about how infectious or how easily this spreads, I would say that it definitely spreads more easily than influenza. We're clearly experiencing that, maybe not quite as easily as measles. So it's kind of in the middle. But how does it spread is really important. And the thing that we know, the most common cause of spread of COVID-19 is from person to person. So this means usually that people who are in close contact, although it sounds pretty icky, we didn't know how much how much water we get out when we talk, but they're from respiratory droplets, either from coughing, sneezing, or even just talking. So again, it's that person-to-person spread. Now, can it spread from being on a surface? The answer is yes. It's kind of rare that it spreads from touching on a surface, but we know that it can happen. Good news is, in a sense, it's kind of a wimpy virus, so just some of that 10% bleach solution can wash it out. So it is easily removed with simple sanitizing procedures. So again, main source of spread, me to you, person to person. So that's something to keep in mind when we think about how to be safe. So again, so what can prevent this? Well, physical distance. So you all are tired of seeing it, but you know, the keeping 6 feet apart, I think that might be not even the width of a tractor. I'm not sure. I guess it depends on the size of a tractor. But 6 feet apart is what seems to be far enough distance that if someone is spreading it, it's going to fall to the ground and not get that other person. Other things that we know, frequent hand washing, not just the little 2-second one, but the full 20 seconds where you're singing your favorite song and getting all the surfaces of your hands clean. Talked about it being on surfaces, so frequent decontamination of surfaces. Those 3 are the big ones. Other things that we do to prevent the spread. If someone is ill with this virus, we have them stay in isolation, all right? So they stay where they're living and eating apart from others so they don't have the opportunity to spread this. Lastly, and I'm sure you've heard about this a lot too, personal protective equipment. So that would be sort of the hospital grade things, surgical masks. There are certain type of masks that are called respirators, which actually can protect the individual. Those pretty much are going to our hospital workers and frontline workers. So those are pretty much in short supply. The face coverings that we talk about, so when I say face coverings, that's what I'm referring to, like cloth masks that we might wear at the grocery store. The cloth masks don't protect me, but they do keep me from spreading the virus somewhat. Not 100%, but it's something. So when I go to the grocery store and I put on my cloth mask, which I keep in my purse and one in my car, that's what I do to help protect everyone who lives in our region. So we'll talk more about this and how it relates to folks coming in and working about that later. Phew. Okay, so that was an awful lot of a quick overview of the virus. Now we're going to get into the sort of nitty-gritty of the ORSHA rules that have come out. This is available in many forms. There's the longer 20-page version. There's a short, I think it's about a 2 or 3-page version. And of course, if you don't have these, absolutely get in contact with Ashley. She can also share my email as well, because these are things that you will need to reference again. These slides can be made available, but I thought I'd hit the high points. And again, I'm sure that you're aware of some of them. So the first thing, sort of work site readiness. What stuff do you need? Obviously, much of this is things that you already did, but I'm going to highlight the changes. All right, so for field sanitation, toilet and hand washing facilities, previously, I understand your guidance was that you needed to have 1 of those per 20 workers. That ratio has changed, so now you need 1 for every 10 workers. Now, the other things, this had been added. I understand that previously it was always that it had to be within a 1/4 mile of workers. Then they added this and it must be located at the entrance or exit to the field or in a completely harvested area, whichever is closer. So the way that I have interpreted that, and this one I'm definitely not the expert on, but the way that I interpret it is that it means that instead of putting 1 a 1/4 mile in from the entrance, you need to have 1 at an entrance and then potentially a 1/4 mile in. But again, I think that our tree doctor, Dr. Ashley, and other experts in the field will probably be able to interpret that a little bit better. The thing I do know is that those need to be sanitized at least 3 times daily. I'm sure most, if not all of you on the call, understand that you know, sanitizing and disinfecting are different than usual what we think of as cleaning. Cleaning, of course, is like getting off regular dirt from surfaces. Sanitizing or disinfecting is when you actually put stuff on there that's going to kill the germs. So again, for that, there's either the agents that you usually use, or again, since they've been in short supply, 10% bleach solution can do it as well. So that's kind of the stuff that you need. So you need these potentially extra hand washing sites, and then they have to be sanitized 3 times daily. This is another important thing that it's just a couple times in the guidelines. So I'm going to talk about this ensure 6 feet of separation during work, but also during breaks and meals. And I want to have this caveat. The 6 feet of separation is because I understand sometimes people work side by side with a family member. If someone is in your family circle, has lived with you, you're in close contact all the time, that 6 feet of separation is not necessary. But for anyone else, or any individuals who have not come here from living in the same household and being in close contact, we're really trying to get people to provide 6 feet of separation during work, breaks, and meals. There are caveats to this, and I understand that there may be times that this is not 100% possible, and I think that there is understanding on the part of ORSHA, but these are kind of what we call best practices. The other thing that I believe is interesting is that, and new, that each orchard or each grower is required to designate a physical distance officer to plan and implement the work practices. So I think that means, the way that I'm interpreting this, and I've talked with others, there just needs to be someone who's on site, either someone who permanently works for the organization or who is designated temporarily, someone who can kind of keep an eye on things and remind people, oh, hey, we need to do this, or this is the way that we have decided that we're going to go about this task to minimize people coming close together. So that is more about the work site, and I absolutely understand there are huge differences between where places are, fruit is getting packed and out in the field, and so definitely keeping that in mind. This is to do with housing, where people are living, people who are not the permanent residents of our area. So there's no change in the square footage requirements. The request is for the beds to be separated by 6 feet. And if you can put people head to toe, if you think about that, that way if they're breathing, they will breathe on someone else's feet and not in someone else's face. Not a bad idea. If you're not able to have that 6 foot distance, and again, this is for people who are not already family members, then there does need to be an impermeable barrier, and there are some specific guidance around that. We can go into more details. Bunk beds are prohibited and by unrelated individuals. Again, kind of getting back to that, they're already in a close family, tight family, then this doesn't apply. Other things, 1 toilet facility per 10 people as opposed to per 15. And then the common use surfaces like toilets, sinks, kitchen counters, etc., must be sanitized 2 times daily. And the requirement, which I suspect this has already been a requirement, but this, since I'm not that knowledgeable about it, the employer must provide the cleaning materials. And again, even as I mentioned at the work site, but also in living facilities, you're required to designate someone as they say social distancing, but in Oregon we try to use physical distancing, so the physical distancing officer. There's nothing specific about what the actual duties of this officer other than, in other words, there are no written reports, anything like that. These are not the type of officers who give out citations, but it's just, again, to have a plan and have someone who has eyes on the situation and can try and ensure that people remain safe. Transportation. I think they went back and forth on this from what I understand, just from various email streams. The recommendation, again, is that people are 3 feet apart. Again, non-family members, 3 feet distance between travel and employer-provided vehicles. They are requesting that people have facial coverings. So again, those sort of cloth masks are things that we talk about both for the passenger and the driver. And then that high contact areas of the vehicles, so door handles, seats, and steering wheel, be sanitized before each trip, or at least 2 times a day if it's in continuous use. So in the morning and at lunchtime, we're using it all the time. Okay, so that was the stuff that you needed and some of the things that you needed to do. And now I'm going to talk a little bit more about the communication piece. And again, I know that there are all kinds of agencies and organizations who are really available to help with this. So, and again, I'm also sure that some of this these are rules that you're not unfamiliar with. So notices must be posted in employees' most commonly used language about field sanitation rules, where restrooms are, and other messaging around infection prevention. And I'll tell you, there's plenty of that. I think there will be a much bigger emphasis on education to supervisors and employees about how to reduce the spread of COVID-19. And I know that our local medical partners are really ready to be able to help implement some of this training. We are expecting that information will be provided, and also regarding access to healthcare and also social services. Again, these are things that I know that you do, and we have lots of community partners who are willing to assist, of course, with providing the services, but also with the messaging and the connection between your workers and the resources in the area. So, and there are just more information than there is more information available than you could possibly want or need. A lot of it, again, I understand the majority of the workers are Spanish will be their preferred language, Spanish language graphics, there's videos, websites, Facebook pages, radio spots, and I'll give a shout out to our very own Radio Tierra. I put the call letters and some of the numbers up there, which they have been providing just super high quality information that is available in Spanish language, and I think they're a great resource. So I'm just going to show you a picture of, this is just one of the many, many, many signs that are available. This one is in Spanish. There are things that are available in English as well, which it's really nice to have just some of the basic things, like what are the symptoms of COVID-19, fever, cough, and a hard time breathing. So again, all kinds of things available. Okay, checking my watch. I'm doing okay. I thought this would take about 30 minutes, and I'm trying not to talk too fast. So, most important thing that can be done to help prevent the spread of this infection and to keep everyone safe is trying to keep space between workers. Again, I understand that this is not going to be 100% possible, but that's the most important thing that we can do, which is, of course, why we've all been trying to stay home as much as possible. Another option, and this is an option, I will say, and it is, I think it's a very good option, and I would definitely encourage you to do it, but it is an option, is to consider daily screening for symptoms. So in other words, of course, at the beginning of people, the orientation, you will say, please make sure that someone knows if you have a cough, fever, chills, headache, sore throat, etc. All those symptoms that I went over, make sure that you tell someone if you have those things. However, we know, just because of how humans are, we forget things. And so a daily reminder or a daily checklist is something that is encouraged but not mandated by any means. So I want to be clear about that. I would also recommend then not only ask about the symptoms, but just a brief, remember to give people an update, because it's so easy. Everyone is super busy. People are working really hard, but just to remind people, don't forget about your hand washing. Don't forget about trying to stay apart. Use your face covering if you're within 6 feet of people. So those are the COVID-19, best practices. Now, in terms of visitors, this has to do with, of course, some people outside your organization, or perhaps others, who are coming in just to help with contact tracing, and that's a whole different thing that we do at the health department, but to help with that, if you do have visitors who come and who might be in close contact with workers, please keep a logbook. So in case we need to reach out to them later, we know who has come to visit. Thank you. And then again, along with the best practices, for people to wear their cloth face masks when they're working within 6 feet of others, or in a vehicle. So now we're going to get to the point to what to do if a worker is ill, because I'm sure this is something that people are concerned about and is coming up. So let's say either one of your workers answers yes to those screening questions. Yes, I have a fever or a cough or new shortness of breath, or they're ill. First thing to do, you would isolate them from the other workers. You would ask that worker to put on a cloth face covering, make sure they wash their hands. Now, the next thing is that to aid the worker in obtaining medical care and probable testing for COVID-19, if that's appropriate, arrange transportation as needed. So this is what I want you to know, that This is where absolutely your community partners are here to help you. You know, One Community Health and Mid-Columbia Medical Center are going to be partnering with orchards, and I think kind of a little, I want to say divide and conquer, but you know what I mean, to support different orchards, and they will be available. I know that there's a lot of work being done to be able to set up a telehealth spot, so either just with a phone call or maybe even video conferencing, that person can safely have a consult with a medical care provider and see if they need testing or the best things to do. And of course, other things come up on the job site as well, so we know that. Transportation, if the person is not able to go in a private vehicle, like their own private vehicle would be ideal. Let's say I have a sore throat, but if I need to be tested, I can drive myself into town. That's the best case scenario. Nothing is available. Reach out to your health departments, and we are also helping provide transportation. As you know, I suspect that people who are ill need to be isolated, and this I understand is a big source of concern. Now, I also understand that some orchards might have facilities, a place where people who are ill can isolate away from other people, and other orchards may not. So I want you to know that both health departments, again, and a lot of other community partners have been hard at work securing hotel rooms for your workers if they need to be in isolation if they are ill. So, you know, I will get into this a little bit more too. There is the possibility that people who are exposed to someone who is ill will also need to be isolated, only we call that quarantine. Isolation's for when you're sick and you need to be away. Quarantine is for when you're not sick, but you've been exposed and you need to be away. Essentially, they end up being the same thing, they just have different names. So you can see from my bold, local health departments can help. And I just mean that we help with the arranging, but it's really all the community partners who are helping with this. So I hope everyone takes a big deep breath. Brian told me that I have to emphasize that. All right, going on. So what happens, let's say your person is isolated, they've tested and they're positive for COVID-19. They're safe. People, community partners are helping bring food, etc., to that person. What happens next? Well, public health will be in contact with you and your worker to figure out who has been in close contact to that individual. For our purposes now, close contact means to be within 6 feet of an individual, so closer than 6 feet for more than 15 minutes for the time that they're sick, and even 2 days before the time that they're sick. It's a broad definition. Those people who are in that close contact also are requested to be quarantined. In other words, to be away from everyone else for 14 days. That's a very big deal. So close contacts, even if they don't have symptoms, are requested to be in quarantine for 14 days. Those individuals be instructed to monitor their symptoms twice a day, and that's something that the health department helps with. Other things to think about, let's say that the person who is ill had been using equipment or maybe had been in a packing house. Want to think ahead of time about, oh gosh, what will we do if that happens? There are instructions for cleaning outdoor spaces and indoor spaces. Best case scenario, again, knowing this may not be possible, best case scenario, if you had all the time, money, etc. in the world, you'd wait 24 hours before going back in there to clean and disinfect. I suspect that may not be possible. You try and wait to allow whatever virus to settle down. Mask and gloves to the people who are performing any deep cleaning. And again, there's some really specific cleaning recommendations that are available, and we can get those out to you. When do people get to come back to work? Also important. Individuals can come back to work if it's been 7 days since they started being ill, and they haven't had a fever for more than 72 hours, and that means fever. No Tylenol either, no fever reducing things. So no fever for 72 hours, and their other symptoms are getting better. So at least 7 days, and then 3 days without a fever and other symptoms improving. Now, if someone is tested for COVID-19 and they're what we say asymptomatic, so don't have symptoms but got a test, if that test is positive, even if they don't have symptoms, those folks have to be isolated for 10 days before they can come back. Lastly, as you probably got the theme from this, is that we're here to help. There have been so many people who are involved in this. Of course, the largest group, and I'm so appreciative of all the work that you all every year put into keeping your workers safe, and this year absolutely more than others. So of course, all of you growers out there and all the people who work there, but also all these places that I have listed here, OSU Extension, absolutely. Ramos, supposed to be R-A-M-A-S, sorry. That was a local group that's been going on for, I think, 20 years here in Wasco County to help provide services for migrant workers. Our local school districts, I'm not going to go down the list. There's a whole lot of them. So I am now going to stop sharing my screen, take a deep breath, and I'm going to let Ashley take it over.
Hey, Mimi, we got some really great questions. We didn't get nearly as many as I thought, but the ones we did were incredibly thoughtful. So I'm really grateful for all of your good questions, guys. I'm going to ask a few questions and hopefully you can answer them. And these, I'm still going to make sure we get good written responses to these that we can put on the Facebook, or not the Facebook, the website. So my first question for you, Mimi, is if we think someone is sick on our farm, who should we call first? What should we do?
Oh, that is a great question. So as I said, if you think someone is sick, so presumably your orchard will have made connection with one of the local clinics, either like Mid-Columbia Medical Center or One Community Health. So you'll kind of have that point of contact. If you don't, that's okay. You can always call one of your friendly local health departments and we will set you on the right track. But the first thing to do is, again, have that person kind of be separate from other folks if we think that they're sick. And then you're going to get on the horn if it's the primary care place like One Community Health or Mid-Columbia Medical Center, and say, hey, and they have interpreters available as well, of course, or you may have one at your orchard if needed. This person has these symptoms, what would you like us to do? And they may say, oh, I think it'd be a great idea for them to get a COVID test, and either, depending on what the resources are, either we'll come to you or we'll have that person come down to the clinic and go from there. So there are, again, a lot of resources. We definitely want to have that plan kind of in place before we get there. So I hope does that answer the question?
That does answer the question, I think. So,
oh, can I add one thing? I'm so sorry. So just so people know this, so cost, of course, always an issue. This is very important. So COVID testing, any treatment related, it's all covered. So you may, for a while, there was a very odd rule that people who are on COM, which some of your workers may have that, they had to go to the emergency department to have COVID testing covered, and happily they've changed that rule. So even if people have no insurance or or have insurance, whatever it is, there's not going to be a copay and there's not going to be a charge. So we really want to encourage all those people who have symptoms to make sure and get it checked out. Thanks.
Thank you. That's really important. So we really are encouraging people, if you can screen, to screen. And one of our growers had a question, are thermometers integral for screening? Do we need to have thermometers?
Yeah, that is a great question. And we have actually ordered a bunch, but I would say when we ask people if they are in quarantine, so in other words, for 14 days, and every day we call them up and ask their symptoms, we actually specifically do call out for them to check their temperature. So we will make sure that thermometers are available. But in terms of people coming to work, kind of a bonus round, if you have one of these Zappy thermometers and people are willing to do it, that's fine. It is not necessary. It's not a bad thing, but if you don't have it, so if you do, great. And if you don't, that's okay. Definitely asking people about symptoms is probably going to be more worthwhile.
So I think this is a really good question. Quarantine for a person that has been in close contact that has not had symptoms will be very impractical and hard to enforce individuals to comply with. Will testing be available, and will negative tests allow the individual to go back to work?
One, I 100% agree that that's a huge heavy lift. I completely get that. And I will remind everyone, yes, these are the best practices recommendations. So best case scenario, if that happens, your person is is in quarantine, so away from everyone else for 14 days. Here's what I'll say about testing, and this is when it gets kind of confusing, is even if that person on day 1 of quarantine took a test and it was negative, that only tells you what they are on day 1. It doesn't tell you that on day 3 of quarantine that they might test positive. So unfortunately, we can't test our way out of that at this point. Very frustrating, I know, and a little confusing. But so unfortunately, no. So even if you were next to that person who became ill, if you're in really close contact, we're still going to recommend the isolation. Here is one, and testing won't wait out of it. Here's one thing that I will say, just for people who are in healthcare who are like, well, wait a minute. I was told that if one of my workers was in close contact or whatnot, that they could come back to work. And I will say that right now the guidance has separated out healthcare workers from other workers. So a healthcare worker comes into close contact, they actually just are able to go back to work as long as they use the right PPE and they check for symptoms twice a day. So recognizing that, I'm sorry to make this so confusing, but there are kind of different degrees of standards, and what we're asking of people are, again, are there, these are what we're encouraging, these are best practices, and we're going to go from that.
Amy, you sort of already answered this question, but I think it's really important because it can be a big issue on the farm. What can someone in quarantine do? Can they work if in quarantine they are separate from other crews? And what degree of separation do they need? Can they be in another field? And this is something I've been thinking a lot about.
Oh!
People work in groups, right? So if we have a group of 5 people that have been in contact with this one person, can we have them in another part of the field doing another task?
If they, you know what, I
know it's, you don't want to be
don't think I'll lose my job. No. I think this is a really important thing because, of course, let's say there's a family, so one person we know is ill, but the other 5 people, well, they're all gonna, be in quarantine together. And so can people work together if they've all had the same exposure and there's no way they're going to expose anyone else? I would argue a yes on that. And I think even the OHA would be hard pressed to say that, no, that's not possible. So as long as those individuals can be working together away from other work groups, everything's able to be sanitized, that seems like that would be an excellent option.
So can you speak a little bit more to the capacity the region has for motel housing for quarantined workers, and if there will be any cost to the growers for those hotel rooms?
Sure. What we are doing, and it's kind of going back and forth, but I think we're getting down to it, is that we're working with some of our local hotels to be sure that there are spaces for workers who need isolation and or quarantine. So as you know, we have a lot of hotels, especially a big new one, and because tourism is obviously still very down, they have a lot of occupancy. In terms of payment for the hotel, this one's going to be a little bit tricky. I think that, and I don't want to, I will say that there are funds through the health department that are available for that. I think in what we hope through the health department is that, for example, for some of these funds, that if we put them out, we'll be able to reclaim some of the money back through FEMA. Probably we will reclaim 75%, and then we might request of the growers to be able to provide that other 25%. But I think that the important thing is we absolutely want to be able to provide for that isolation housing. We feel very confident we'll have enough. And that my important thing is, like, we will take care of the cost first as much as we can, and then work to get funds back through the feds. And then if there's a huge budget discrepancy, we may reach back out to orchardists for 25% if needed. I know, not super clear, I'm sorry.
Yeah, and that's sort of some of the problems with all of this stuff is it's not super clear, and some of it you need to be an attorney to really figure some of it out too. And this is a question Brian and I were trying to answer. Will workers be paid for their sick time? And what if an employee refuses a test because they believe that their family will be quarantined and unable to earn a living?
So great questions, two separate ones. In terms of the sick time, I'm definitely not an expert in this. And so that has to be the terms of people's employment. I would know, I would just note that sort of I just can't speak for that industry. So I'm just going to let that one go.
That's okay. We'll try and get it answered.
Yeah. In terms of, can people decline testing? Absolutely. Yes, people can decline. We all have rights. So people can decline testing. If, however, as an employer, you feel that someone is is ill or poses a risk, you can also decline to have them work. So sort of a two-way street. And so we're really not trying to coerce people into being tested or anything like that. We really want people to think about their own personal safety. And I think kind of putting it folks that way, always being cognizant that I understand that people's incomes are crucial as well. So.
Mimi, thank you for answering most of our medical questions. If you did ask a medical question and it didn't get answered today, know that we will answer it in the future. We're going to start talking a little bit about the supplies we're trying to get for the orchardists. So some of the orchardists will remember a few weeks ago, I sent out a survey and it was, excuse me, my lovely public health folks and county unified people that I've been working with, but it was really to prove to them that we needed stuff. So I sent that survey out to you guys. You were really great about responding to it. Now we have another survey that you need to respond to. And that survey is really so we know exactly how much to order and exactly how much needs to come to your orchard. So I know you guys have been absolutely surveyed to death, but I 110% need you to do it. And if you're not doing it and I have your phone number, I'm going to call you. All right. So I'm going to start bugging you about it. And I have a list of who has and hasn't done it. So you're going to get a call from me. And with that, I'd like maybe Shelly or Dave Anderson to talk about some of the things that we're planning to bring to you guys.
Hi, this is Shelly.
Hey, Shelly, you're breaking up a little bit. Can you start from the beginning?
Sure. Let me know if I'm still breaking up. Is this better? Okay. So what we ask.
You're breaking up again. I'm not sure what's going on your end.
I'm not sure either. Sorry. Maybe Dave wants to speak, or maybe even Mimi. I think she has a little bit of information on this. I apologize.
You sound better when I'm unmuted, which is weird, but go ahead.
Okay, we'll give it another go. So we've heard the masks are certainly a concern, and the cloth mask. We have ordered for the region so far 5,000, and those we anticipate being delivered today or Monday. And we have set up, at least through North Central Public Health for Wasco County, a process to procure those masks by the orchardist. We want to be fair, I guess, in distribution. So finding out a process on how many are needed by each orchardist. That's why it's important for them to complete the survey to give us an idea of how many are needed. And then we'll figure out and we'll order more if we can find them. The second thing is disinfectant or bleach. And we have procured a pretty large number of bleach. And that again, we went ahead and ordered in anticipation that we could distribute it back out to the orchardist. And we are, again, have a process in place to for them to ask how much they need and distribute it. And get payment. We will be asking for, we will only be asking for payment of what it cost us to do it. So we'll start with those two pieces. That's what we've been working on primarily. Again, once we get the results of the survey, we can get a better understanding of what other items are needed. The thermometers Mimi mentioned, we also purchased thermometers. So if screening is happening in the orchards or through potentially community health workers or health department staff, those will be available as well.
Dave, do you have anything you would like to add?
Yeah, I can offer that another thing that we've been working on is exploring the level of interest that orchardists may have to provide enhancements to or creating for the first time Wi-Fi service to the worker camps. The intent here would be to provide an opportunity for workers to have better access to telehealth opportunities as the need might arise. I've been closely coordinating with Ashley to try to reach out and determine how much grower interest there might be in this program. And then we're also evaluating different technologies that might work for us, whether it's setting up through a cell service provider to establish Wi-Fi hotspots or some other technology. So we're spending some time this week trying to get through the technological alternatives analysis and then also reaching out to see who's interested. And I think the good news is that with this opportunity is we've also secured some funding. And we're trying to provide this at no cost to growers who might be interested. So stay tuned on that, and please let us know if, as a grower who has a camp, you might be interested in this type of an opportunity.
Thank you so much, Dave. And that's why it's really important for us to get those surveys filled out. We have some funding that will hopefully be coming through in the next week that we can start purchasing some hotspots and some tablets. And I'm trying to get some help with getting those things set up at your orchard if you do want them. Gladys, can you talk a little bit about what you've been doing to divide up the orchards?
Absolutely, happy to. Hi, everyone. My name is Gladys Rivera, and I am the Preventative Health Manager at One Community Health. So we are MCMC, and One Community Health has a list of all of the growers in Wasco County, and we have divided that list equally to be the health liaisons, as Mimi mentioned earlier in the call, to you growers, so that you can call us and we can help with on-site testing for those employees. And we can also help with education materials. As Mimi shared earlier, she has beautiful one-page infographic flyers that we also have. There are many different versions of them, but that is how MCMC and One Community Health are, again, your health liaisons to help assist during this time. I want to remind everyone again on this call, you're not in this alone. We're not expecting you to do this all on your own. You do have health through the North Central Public Health District, MCMC, and One Community Health to help you along the way. I also included that list. I gave that list to Ashley, so she has it and she will share it with you. And that list also has contact information, so that way you can get a hold of myself or get a hold of Linda Compton at MCMC.
Yes, so I sent the list out yesterday. I know there's a couple people who think they might be missing and a couple little issues. And if you do have some sort of problems and you're not sure who to contact about that, can we reach out to you, Gladys, or Linda? Who should we reach out to?
Absolutely, I can. Let me provide the phone number. So if you are having any issues, you're not sure who's on your list, whose list you're on, you can call me at 541-256-4239, and I will share that number with Ashley as well, so she can send in the minutes to everyone. You can call me and I can tell you whose list you're on.
Thanks so much, Gladys. And this is just a reminder to everybody, this will be, this webinar is being recorded and you will have access to it. I'm going to try and get it on to the OSU YouTube channel. I'm also going to try and link it to the Wasco County website account. And then we're going to take all the questions that may not have been answered and we will get those answered for you. I know we have one really burning question about bleach. And that question is, do we, right, burning and bleach. I have read that the 10% bleach solution must be made fresh each day, not left over in a spray bottle as it loses its effectiveness. Is this true?
I'm going to ask my environmental health experts for an answer to that because I can't say for sure, but we will get that answer rapidly.
Yes, so any question that didn't get answered today, guys, I really am going to try and get these answered. Oh, it might take us a couple days, but I promise we'll all be working on it. I'm trying to think if see if there's any other really pertinent questions. I think this has been really informative. I'm so glad so many of you came out today and we had so many great people speak to what we're doing here. And Orchardists, please know that we're here to help provide you with the expertise that we need to get through this together. And please feel free to reach out to me, do your survey, or I will be reaching out to you, whether you like it or not. And anybody else have anything to add today? Nope, all right. Oh, this is Arminda from OCDC. We are wondering what will be the best way to distribute grower packets this year since we don't have a table at the grower luncheon this year. We are more than happy to mail them or come up with any other solution. So we will talk more about that. Arminda, the other really important question, I think this is still being sorted out, is what will the children be doing with OCDC not open? I don't know if we have any OCDC people on the line. Arminda's here. Let me see if I can make her a panelist really quick. Arminda, for some reason, I can't make you a panelist. I'm sorry. But we'll try to get that information to you as soon as possible.
Ashley, this is Shelley. I can speak just a little bit to that.
Oh, yeah, sure.
I believe OCDC is still going to be open. They just have some new guidelines that have some restrictions, so they can't maybe see the same amount of participants. But I know through RAMIS, they've been working really hard to finalize what they can do and how they'll transport and how many participants they can have and ratios around that. So I know they'll be putting out some more information on that and potentially even some education in the orchards for the children and stuff like that. So they're really being thinking outside the box and coming up with some great ideas, but there will be some support from OCDC.
Thank you so much, Shelley. So this is another important question. Are all the resources and services available in Hood River and Wasco County? And the answer to that is definitely a resounding yes. And if you guys are in Klickitat County and there's something you really need, I know I have a grower that asked if he can have access to bleach, and we agree that, you know, we can have, you guys can come over here and get bleach from us in Wasco County. So know that we're here for you and we're trying to get as many resources available as possible. So somebody else asked, how are we going to deal with the already limited resources and the extra population?
So this is Dr. Mimi again. Hey, in terms of, I'll just say from the public health standpoint, I've been planning on this and we're absolutely ready from the public health standpoint and the medical standpoint, are anticipating folks coming into our region. So we feel confident that we have the PPE, we have the medical resources to help people. There's been a tremendous outpouring from social services, Oregon Food Bank, all kinds of things to help with that. There's still some limiting factors. I know classroom space, I saw the Ericksons are saying they're adding more classroom spaces. So For childcare, there's some issues, but people have been super duper hard at work planning for this, anticipating that. And so I think that, again, luckily, because of where we live and that the burden is very low. And I also want to share with the growers, sorry, last thing. When we look at the counties where people from California are coming from, it appears that their kind of rate of infection is kind of about the same as ours. So it's not like people are, as far as I know, y'all are flying people in from, you know, whatever, New York City or something. So we don't anticipate a massive change in the percentage of people who might carry this virus. So that's another good thing. But from the medical standpoint and other services, we've been planning and we are as ready as we can be.
Thank you so much, Mimi. Also, Nicole Bailey has an answer for the burning bleach question. Nicole Bailey is an environmental health specialist, and she can verify that we need to remake bleach in spray bottles, or we can verify the need to remake bleach with chlorine test strips. Sorry about that, guys. So we can verify the need to remake bleach spray bottles with chlorine test strips. So is that something that's going to be, you know, widely available though? That seems like it might be difficult to do.
This is Shelley. I think we can look at that with our process of releasing the bleach or distributing the bleach to the orchardists. If possible, maybe we can provide some of those strips, or at least where they can get them in our process. We'll talk about that at NCPHD and put that information out with the information when the bleach is available.
So Shelley, do you know if there's going to be any additional worker housing provided to alleviate the shortage?
I do not know that. I would put that to the orchardists as far as what they might have in addition. The information I have heard is that most of them do not have additional housing, and I have not heard of any housing being sought out beyond that, except for, of course, the hotel rooms for people that are ill.
And you know, that's something, you know, maybe the orchardist who wrote that in and I can talk about a little bit more and try to identify what exactly that need will look like and how we can work with them. All right, guys, it is 2 minutes after 11. I want to thank you all for joining us today. I'm going to record all of these questions, like I said before, so if they didn't get answered, we will make sure they get answered in the future. Thank you all for tuning in, and look for this webinar showing up on the OSU YouTube and on the Extension webpage. Thank you so much.